Hi everyone, in this video we study about diabetes insipidus. Diabetes insipidus is a word derived from two words. Diabetes mean urine and insipidus mean tasteless. On the opposite side we see another condition which we called diabetes mellitus. That's condition meaning is urine. Diabetes mean urine, mellitus mean sweet. So that is called sweet urine. This is called tasteless urine because in diabetes mellitus in urine glucose present. That's why this condition calls sweet urine, and in this condition due to absence of glucose this we called tasteless urine. This is the meaning of this word. And first of all, diabetes insipidus is a condition in which due to insufficient function of ADH hormone, antidiuretic hormone, patient present with excessive urination and polydipsia. First of all, it is occur due to ADH insufficiency. On the insufficiency of ADH, we divided it into two types: central diabetes insipidus and nephrogenic diabetes insipidus. We take a look one by one here. First of all, central diabetes insipidus. Central mean there is a problem in center of body. Center of body is brain. There is problem in brain. In brain or in a brain problem is in brain, and due to this problem patient present with diabetes insipidus. Problem is will in the hypothalamus or in posterior pituitary. First of all, we have to know quick review of. First of all, we have to know about antidiuretic hormone physiology. Then we study about its pathology. For a quick review, I draw here ADH hormone and its some function. Here is ADH hormone. ADH hormone is released and produced in the hypothalamus and then is stored into posterior pituitary. From posterior pituitary, when body need to save water, when the body is in the condition in which dehydration occur, but hypothalamus tell posterior pituitary to secrete ADH antidiuretic hormone into circulation. From circulation, antidiuretic hormone go into kidney. In the kidney there is receptor of ADH hormone present, which we call vasopressin receptors. Vasopressin 2 receptors. V2, name of receptor V2. This receptor present in the tubule of kidney which make urine. When ADH bind here, it do changing in these receptor cells and stimulate these receptor cells to produce a special protein in their membrane, which we called as aquaporin. These aquaporin protein start producing at the membrane of tubule, and then these aquaporin protein start expressing on the membrane of tubules. For example, here I draw. Here is the tubule, here is the blood vessels, and here is the aquaporin channels or aquaporin proteins. These proteins are like a pore formation in the tubule, and then these protein form here, and now when water come here, water start leaking from here into blood, and mostly when we need it, water from here come into blood vessels, and need of water in body is fulfilled. Okay, then this is the normal physiology of ADH hormone. Then we now study about diabetes insipidus, in which insufficiency of ADH occur. How? First of all, we are discussing now central diabetes insipidus. In central diabetes insipidus, I said that this is occur due to problem in hypothalamus. Is that hypothalamus not making ADH hormone or posterior pituitary hormone not secreting into circulation. Maybe both of either. It may be hypothalamus problem, it may be posterior pituitary problem. Why this problem occur? First of all, we're discussing about its cause and how this cause progress to central diabetes insipidus. First of all, it may occur due to tumor, any tumor of hypothalamus or any tumor of pituitary gland which suppress its cells to secrete hormone into circulation, or maybe it's trauma, any accident, or maybe it's infection or inflammation of posterior pituitary cells. It may occur due to these condition, and these condition progress into destruction or not secretion of ADH into circulation. Now problem is that ADH is not in circulation. Okay, I said that function of ADH is that it save water in the condition of dehydration when we need to save water. For example, if a patient not take water for 36 hours, this patient urine will have to be concentrated, not dilute. If a patient present with 36-hour history of not taking water and dilute urine, this patient will have problem with ADH hormone. Okay, now ADH is not present in circulation. Now what will happen if ADH not present here? Now discussing about sign and symptoms. What symptoms will appear in patient which will not have ADH hormone? First of all, this patient, as I said that this ADH function is that it start formation of pores and start saving water in our blood vessels and start transfer water from our tubule into blood vessels. If no water here, if no water go into here, then what happen? All the water start go into in our urine. All the water start go into urine bladder and then into urine to our excrete from body, and all the water go into urine. And this condition in which excessive water loss from body, this we call polyuria. Okay, first of all, patient present with polyuria. Second, due to excessive water loss, as excessive water loss occur in this condition, due to excessive water loss, body will start in stimulating our third system present in brain, which start to please intake more water. We need water. Then then what happen? Body said to our brain start activating thirst center. If thirst center start activating, then what happen? Thirst center start body to tell to body to intake more water. In this condition, in the condition in which body take more water due to thirst, this called polydipsia. Second most common sign and symptom appear in this patient is polydipsia. Then third most common symptom present is high serum osmolality. What is serum osmolality? Serum osmolality means the patient, the quantity of solute higher than solvent. Quantity of solute higher than solvent. What it mean? For example, if for example here look, all the water start losing here because no ADH present, no pore formation, no blood save, no water save here, and all the water lost. So all here is blood. If patient not intake too much water, then what happen? The solute present here start increasing, solvent start decreasing. This condition is called high osmolality because no water is here. All the water loose. If all the water loose, no water will remain in our blood vessels, and this solute will higher than our solvent start increasing. Then this condition we said that this is called high osmolality of serum. Serum is blood. Serum, high osmolality of serum. Then third most common symptom appear in this. Then fourth symptom will appear hyponatremia. Hyponatremia is high sodium level in our blood. As no water here, all water loss, solute is start increasing. Sodium is also a solute, and sodium level also start increasing. Okay. Then fourth most common symptoms which appear is low urine osmolality. Osmolality mean low solute in our in our solvent. Let's see here. Look, if we in a urine, as urine contain large amount of water, if urine contain large amount of water, the solute amount, the amount of solute in our urine start decreasing. If amount of solute start decreasing, then what happen? This we call low urine osmolality. Okay, these are most common symptoms which will appear in all central diabetes and nephrogenic diabetes and insipidus patient also. Okay, then these are the most common symptoms. Then we study about its diagnosis. What we'll do? We start checking about is this patient is having ADH or not. Problem is with ADH. First, these are special tests which we call water deprivation test. Water deprivation test we do. What we'll do in this? We will do that. We instruct the patient that please don't take water until 24 hours, and then we observe urine of patient. We take a urine and observe it. Is it dilute or solvent? if a patient have ADH normal, then the after 24 hour urine will concentrate, because after 24 hour ADH will start releasing, ADH start releasing and act on receptors and start saving water, and urine will become concentrated. If a patient of central diabetes, or if the patient of diabetes insipidus present, this patient will have dilute urine after 24 hour also. This is the best test we can do to check diabetes insipidus. Then second, we can also diagnose by patient history. Then last about its treatment. Of treatment we can do is a special drug, very friendly drug, is called desmopressin. Desmopressin is a drug which is analog of ADH. Analog means is act like ADH. It is the laboratory making ADH hormone, antidiuretic hormone, laboratory make antidiuretic hormone, and this ADH hormone will this drug will act like ADH, and in this way we will fulfill the demand of ADH here, and patient will start saving water. Okay, this is all about central diabetes insipidus. Okay, in the contrast of this, I draw here nephrogenic diabetes insipidus. Okay, I said that diabetes insipidus divided into central diabetes insipidus, which is problem with center of body, brain, hypothalamus either or posterior pituitary. Second is nephrogenic diabetes insipidus, which is nephrogenic mean kidney, problem of kidney. I previously said that our receptors of ADH present in kidney. Okay, if a problem with receptors, then it's nephrogenic diabetes insipidus. If a problem with center, then it's central diabetes insipidus. Okay, what is the causes and pathogenesis of nephrogenic diabetes insipidus? Most common causes is it may be an inherited mutation of a specific gene which we call AQP2 gene. AQP2 gene is a gene which do instruction for making aquaporin proteins. These proteins, as we discussed, that these proteins are tiny channels. These proteins form tiny channels between water and between blood vessels and tubules. These proteins perform a very specific function. These inherited mutation, if in these genes occur, then what happen? Aquaporin protein not form. If aquaporin protein is not formed, there is problem with receptors occur. Receptors not transduce its mechanism properly. Then what happen? The patient will present with diabetes insipidus. Okay. Then second most common cause is drug toxicity. The most common two drugs which I'll see here, lithium and demeclocycline. These two drugs are very toxic for antidiuretic hormone receptors, and it may inhibit the formation of aquaporin proteins. And if these drugs will take a longer time, then what happen? These drugs start inhibiting aquaporin proteins. If aquaporin proteins not form, then will not formation of pores in our tubules, then not water saving occur, and now this patient also present with diabetes insipidus, and in this case the patient will have nephrogenic diabetes insipidus. Okay. Then third most common cause is chronic kidney disease. Patient may have chronic kidney disease. Due to chronic kidney disease, there is a problem with receptors occur or maybe it's an idiopathic disease. Idiopathic cause, maybe the idiopathic, which we don't know, which is under investigation, which cause is under investigation. Now we discuss about sign and symptoms. Because problem with ADH hormone is either he not responding to its receptors or is not releasing from its hypothalamus. Problem is ADH. If ADH not released, then all these things will occur. This patient also present with polyuria, polydipsia, hyponatremia, high osmolality, low urine osmolality, high serum osmolality, and low urine osmolality. These same symptoms will occur in this patient. Okay. Then we discuss about diagnosis. Then interesting thing is that these differential diagnosis we done that in the basis of desmopressin. As desmopressin is analog of ADH, as we discussed here, analog of ADH. If we give this analog to the patient which nephrogenic diabetes insipidus. Then what happened? Desmopressin is the analog of ADH. As in this condition, ADH present in our body but not responding to receptors. If we give another ADH, this will also not responding. It is also do a specific receptor function also it do, and show some benefit in this patient, but this will show poor response because desmopressin is mostly do function of ADH analog. If ADH analog function will occur, if ADH analog function will give, this will not give us a more benefit than in central diabetes insipidus. Okay, then we can also do genetic testing and check the specific specific genes which AQP2 and another genes which do instruction for making aquaporin proteins. These genes may cause problem to formation of nephrogenic diabetes insipidus. This we can also check. And then treatment is treat underlying cause. First of all, what if we underlying cause is drug toxicity, we have to discontinue this drug. Okay, then we can also do preventive measures, salt restriction and teach patient to take more fluid. This can also help out. Okay, this is all about diabetes insipidus. I hope it helpful for you. If you find it helpful, then please do like and subscribe. Thank you for your attention.